A hoarse voice after 60 can seem easy to explain away. Maybe you had a cold, maybe the air was dry, maybe you talked too much the day before, or maybe you simply tell yourself, well, I'm getting older. And sometimes, that explanation may be right, but when your voice stays rough, weak, raspy, strained, or breathy for weeks, or when it keeps coming back without a clear reason, it deserves more attention than a shrug, because your voice is not just a sound. Your voice depends on the vocal cords, the throat, breathing, nerves, swallowing muscles, hydration, reflux patterns, medication effects, and yes, sometimes age-related changes, so a hoarse voice does not automatically mean something serious. But after 60, a voice change that does not clear should not be dismissed as just aging. It may be a body signal. And the goal is not to panic. The goal is to notice what has changed, how long it has lasted, and whether your body is asking for a closer look. Many people think hoarseness means one of two things. Either you caught a cold, or your voice is simply wearing out with age. But the voice is more complicated than that. When you speak, your vocal cords come together and vibrate as air moves through them. That vibration creates sound. If the vocal cords become swollen, dry, irritated, strained, weaker, thinner, or unable to move normally, the sound changes. Your voice may become raspy. It may become lower than usual. It may feel tired after only a short conversation. You may need to clear your throat again and again. You may feel like it takes more effort to speak. Or people may start asking, "Are you sick?" Even when you feel fine. That is what makes hoarseness so easy to underestimate. It can feel like a small nuisance, but it can come from several different places in the body. One common reason is laryngitis. Laryngitis means inflammation around the voice box. It often happens with a cold, a respiratory infection, sinus drainage, allergies, or throat irritation. The vocal cords become irritated or swollen, and the voice comes out rough, weak, or uneven. When hoarseness is tied to a short-term cold, it often improves as the illness clears. But if the voice does not improve, if it keeps returning, or if it appears without an obvious infection, it is worth asking why. Another possible reason is voice strain. This can happen after talking more than usual, speaking loudly, singing, yelling, or trying to talk over background noise. It can also happen when someone keeps clearing their throat. Many people do not realize that throat clearing can become a cycle. The throat feels irritated, so you clear it. Clearing it irritates the vocal cords more. Then the throat feels irritated again. This does not mean you damaged your voice by speaking. It simply means the vocal cords can become tired and irritated. Just like other parts of the body, age can also play a role. After 60, the vocal cords may become thinner or less firm. Some people notice their voice sounds weaker, breathier, shakier, or less powerful than before. That can be part of age-related voice change, but here is the important distinction. Aging may be one possible factor, but it should not become an excuse to ignore a voice change that is persistent, worsening, or unusual for you. Aging explains some changes. It does not explain everything. Reflux is another common and often overlooked reason. Many people think reflux always means heartburn, but sometimes stomach acid or digestive fluid can irritate the throat and voice box without causing the classic burning feeling in the chest. This can sometimes be linked to hoarseness, frequent throat clearing, a chronic cough, a sour taste, or a feeling like something is stuck in the throat. Some people notice their voice is worse in the morning. Others notice it after meals or after lying down. That does not mean every hoarse voice is reflux. But if those patterns sound familiar, it is worth asking your doctor about. Dryness and irritation can also affect the voice. Dry air, indoor heating, air conditioning, dust, smoke, strong fumes, pollution, and low fluid intake can all make the throat feel more irritated. Some older adults also deal with dry mouth or dry throat, sometimes related to medications or other health conditions. When the vocal cords are dry or irritated, the voice may sound scratchy, unstable, or harder to control. Medications are another piece of the puzzle that many people overlook. After 60, it is common to take more than one medication. Some medicines can contribute to dry mouth or throat dryness. Some may affect reflux. Some inhaled medications, especially those used for asthma or cough, may be associated with voice changes in some people. This does not mean you should stop an inhaler, reflux medicine, allergy medicine, or any prescribed medication on your own. Never stop or change medication without medical guidance. But if your voice changed after starting a new medicine, changing a dose, or using an inhaler more often, write down the timing and ask your doctor or pharmacist whether it could be contributing. There are also vocal cord problems that need professional evaluation. Sometimes hoarseness may be related to benign changes on the vocal cords, such as irritation-related growths or swelling. Sometimes it may be related to vocal cord weakness or vocal cord paralysis, where one or both vocal cords do not move normally. This matters because the vocal cords are not only for speaking. They also help protect the airway when you swallow. So if a hoarse voice comes with choking, coughing when drinking liquids, trouble swallowing, or breathing difficulty, that should be taken seriously and discussed with a healthcare provider. And we should be honest without being frightening. Persistent hoarseness can sometimes be a sign of something more serious, especially in someone with a long history of smoking or heavy alcohol exposure. That does not mean hoarseness means cancer. It does not. But it does mean a voice change lasting several weeks should not be ignored, especially if it is new, worsening, or unexplained. One common myth is that if hoarseness does not hurt, it cannot be important. But pain is only one clue. Some voice problems are painful, others are not. The length of time, the pattern, and the symptoms that come with it can matter just as much as pain. Another myth is that whispering is the best way to rest the voice. For some people, whispering can actually strain the voice more. A safer general approach is to avoid forcing the voice, avoid yelling, and speak gently when needed. And another myth is that lozenges, teas, or supplements can fix the cause. They may soothe the throat temporarily, but they do not explain why the voice changed. Supplements can also interact with medications or medical conditions, so they should not be treated as automatically harmless. So what should you actually pay attention to? Start with time. Has the hoarseness lasted a few days after a cold? Or has it been there for 2, 3, or 4 weeks? Is your voice slowly improving? Or is it staying the same? Is it getting worse? Does it keep coming back? Then pay attention to the symptoms around it. Do you have trouble swallowing? Do you cough or choke when drinking liquids? Do you have trouble breathing? Are you coughing up blood? Have you had unexplained weight loss? Is there persistent fever, worsening throat pain, a neck lump, or ear pain that does not go away? Did the voice change after surgery involving the neck, chest, thyroid, or airway? These details matter because not all hoarseness is the same. A rough voice for a few days during a cold is different from a voice that stays hoarse for a month. A tired voice after a long conversation is different from a voice that suddenly becomes weak, breathy, or difficult to control. And even a voice change without much pain may still need evaluation if it does not go away. There are safe, practical steps you can take while paying attention to the pattern. Stay reasonably hydrated. Unless your doctor has told you to limit fluids, avoid smoking and secondhand smoke. Try to reduce exposure to dust, strong fumes, and dry air when possible. Do not yell or force the voice when it already feels strained. Notice whether the hoarseness is worse after meals, after lying down, after heavy voice use, during allergy season, after a respiratory infection, or after a medication change. And keep a simple record. You do not need anything complicated. Write down when the voice changed, whether it started after a cold, whether you have reflux symptoms, whether you are clearing your throat often, whether your voice is worse in the morning or evening, whether swallowing feels different, whether any medication or inhaler use changed around the same time. This kind of information can make a doctor's visit much more useful. The point is not to self-diagnose. The point is to stop guessing blindly. So when should you talk to a doctor? If hoarseness lasts longer than 2 to 4 weeks, especially without a clear cold or infection, it is worth making an appointment. If it is getting worse, keeps coming back, or sounds very different from your usual voice, Get it checked if it comes with trouble breathing, trouble swallowing, coughing up blood, unexplained weight loss, persistent fever, worsening throat pain, a neck lump, persistent ear pain, or choking when swallowing. Seek medical care promptly. And if you have a history of smoking, heavy alcohol use, or surgery involving the neck, chest, thyroid, or airway, mention that clearly when you speak with your clinician. The point is not to assume the worst. The point is to avoid dismissing something that has been trying to get your attention. Your voice is part of your independence. It helps you speak with your family, ask questions at the doctor's office, tell stories, laugh, sing, pray, and stay connected with the people around you. So caring about a changing voice is not vanity. It is practical. It is health-related. And after 60, it is worth noticing. A hoarse voice may be temporary. It may be from a cold. It may be from reflux. It may be from dryness. It may be from voice strain. It may be related to medication effects. It may be part of age-related vocal cord change, or it may be something that needs a closer look from a healthcare provider or an ear, nose, and throat specialist. The main lesson is simple. Do not diagnose yourself from a raspy voice, but do not automatically blame age either. If your voice is hoarse for a few days, pay attention and care for it gently. If it lasts, worsens, keeps returning, or comes with other symptoms, ask for medical guidance. Because the goal is not fear. The goal is awareness. Sometimes the body whispers before it raises its voice, and sometimes that whisper is your own voice asking you to listen. If you want more calm, practical explanations about health after 60 and the body signals worth noticing, subscribe and keep learning with us.